So you can't put the leg on the floor, you can see there. This is called not bearing weight. Not bearing weight, that means the leg is up. The right hind is bearing. So if it's bearing weight, then it will come down. So this shows that it's quite serious.
A Be Kind to Pets veterinary educational video sponsored by Toa Vets. Hip dislocation in a Border Collie. The right hind leg is dislocated upwards and forward. Hence, the right hind leg is shorter than the left hind leg. The dog was then sent for an X-ray. From the X-ray image, we can see the dislocated right femoral head. The X-ray image also shows that the right femoral head is out of the hip joint. There are two methods to treat a hip dislocation. The first is the close reduction method, which is the maneuvering of the femoral head back to the acetabulum. And the second is the open reduction method, which is the surgical removal of the femoral head. Close reduction method. Step 1. Grasp the affected leg with one hand and under the affected leg with the other hand. Step 2. Externally rotate the limb and pull it such that the femoral head is positioned over the acetabulum. Step 3. When the femoral head lies lateral to the acetabulum, internally rotate the limb so that the femoral head is within the acetabulum. Open reduction method. Step 1. An incision is made directly over the summit of the great trochanter. The skin is then retracted widely and the underlying muscles can be seen. Step 2. A dissector is used to separate the insertion of the superficial gluteus to reveal the deep gluteus. A finger is stuck under the middle gluteus to separate it from the lateral surface of the deep gluteus. Then, both the middle and deep gluteus are detached from the insertions to reveal the femoral head. Take note not to touch the sciatic nerve or else the dog might be paralyzed. Step 4. Blunt edge forceps are used to elevate the femoral head. Step 5. Bone cutting forceps are used to cut off the femoral head. Step 6. The bone is then pulled down back to the hip joint and the muscles are sutured back together. For this Border Collie, the owner decided to use the open reduction method to treat the dog. After the surgery, we can see that the wound has been sutured back together, and we can also see the femoral head which has been cut off. Distance bone cutting forceps was the instrument used to cut off the femoral head in this Border Collie.
The right hip femoral head has been excised, and it has been given its medication, painkillers and antibiotics this morning. Operation was done yesterday afternoon to remove the femoral head. So now the dog will be given an E-collar medication and goes home.
In conclusion, the open reduction method is a more effective method than the closed reduction method to enable the dog to walk normally again, which may take up to 4 weeks.